1 in 3 women over 40 years of age.
Interventional radiology is or through the groin and through we
You
pass.
go to the uterus through the wrist?
Fibroids can present with just.
Hello Covai Post viewers. 1 in 3 women over 40 years of age suffer from this condition called the uterine fibroids. This fibroids is most common among women, and 40 to 50% of these women exhibit symptoms which include excessive bleeding and pain. So today we are going to be talking to Dr. Madan Mohan, the interventional radiologist at the Royal Care Hospital, about uterine fibroids and how interventional radiology could come handy to this treatment and how hysterectomy can be avoided. Hello doctor.
Hello.
So you are an interventional radiologist. What do you do?
So the interventional radiology is a slowly emerging branch, a new branch of medicine, where the physician, the interventional radiologist, he does minimally guided, minimally invasive procedures, what we call interventions.
Right.
By minimally invasive, I mean we enter the human body through very small incisions in the body, say 1 to 2 millimeters, small cuts in the body. Contrast to surgery, where a large cut is made, and we do these procedures using radiology techniques. So that's why the radiology part of interventional radiology comes, meaning specialized X-rays or ultrasound or CT to guide these procedures. So that's what we do in interventional radiology.
Okay. So where does uterine fibroids come here? Is this a fairly new procedure?
Yeah, recent years this procedure has slowly emerged, especially in the Western countries. It's taking time to get foothold here. But with this technique, with the interventional radiology, we target what we call the vessels of the uterine fibroid. So uterine fibroids need blood supply to survive, to grow.
Yeah.
So what we do in interventional radiology is we specifically target the blood vessels that are supplying the uterine fibroids.
So otherwise, on the contrary, what are the other treatments available, and how is this advantageous?
So conventionally, most people know of the surgical techniques that are used for fibroids. Usually fibroids, the gynecologist manages, they start off with the hormonal treatment, and when that doesn't control, they move on to surgical methods. By surgical methods, there are two surgical methods that are available. One is hysterectomy, the whole uterus is removed, and myomectomy, myoma being the fibroid, and myomectomy meaning just targeted removal of the fibroid. Right. So what we do in interventional radiology is we go through the blood vessels. We enter a blood vessel either through the wrist or through the groin, and through we pass.
Go to the uterus through the wrist?
Exactly.
Oh my. Okay.
Yeah. So we pass in small tubes, slender tubes, 1 to 2 millimeters in diameter, and we pass these tubes through with the help of specialized live X-rays, and we navigate these tubes into the arteries that are supplying the uterus. Okay. And once we reach there, we the next step is to block these arteries. Then we inject small fine powder-like particles which will go and block the arteries that are supplying the uterine fibroid.
Yeah. So that way the fibroids shrink.
Exactly.
Okay. So doctor, what is the age group of women that should undergo this kind of procedure, and what are the symptoms? So usually the symptoms that such women exhibit is pain and excessive bleeding. So at what stage should they come to you?
Yeah. So the symptoms when they are limiting their lifestyle, say if the patient is having so severe a symptom, so severe pain that she is during her periods, then it is limiting her lifestyle, and at that point the patient becomes a candidate for embolization. Or if the bleeding is so excessive that the patient starts to lose blood and she slowly is progressing towards anemia, and that is also a candidate. Some cases fibroids may be so large that they will compress the urinary bladder, or they may compress the bowel, and leading to frequent urination or constipation. Okay. So such pressure symptoms. So those symptoms also, if the patient exhibits, and if it is limiting her, is affecting her day-to-day life, then she becomes a candidate for treatment.
Okay. Okay. And so what is the percentage of unmarried women who have fibroids, and how, would these kind of procedures affect their fertility at a later stage?
Yeah, so that's an interesting question. Yeah, so uterine fibroids per se can, apart from the symptoms that I already mentioned, fibroids can present with just infertility.
Okay.
And if a person comes to me with infertility only, and then uterine fibroid embolization is not the right treatment.
Not the right treatment.
Right treatment to undergo. And if you put the question in other way, so can I if a patient asks me, so can I become pregnant after uterine fibroid embolization? The answer is yes.
Okay.
You can become pregnant. There's a 50% chance that you can become pregnant after fibroid embolization. But if it is the other way around, if the patient is infertile and she's undergoing treatment, then this is not the procedure. So for a patient who's undergoing infertility treatment, a myomectomy would be a slightly better option.
Okay.
For treating uterine fibroids.
That is only if she is undergoing infertility treatment.
Exactly.
Okay. So doctor, just as any other invasive treatment, I think the hospital stay and the blood loss would be an advantage. Could you elaborate?
Yeah. So one major advantage, one where interventional radiology slightly scores better, is the duration of hospital stay. Usually the patient comes to the hospital on the day of the procedure. If we plan the procedure at around 10 o'clock, the patient can come around 8 o'clock with her stomach empty, and we do the procedure. Procedure will last, say, 1 to 1.5 hours, and after the procedure we will observe the patient for, say, 6 to 7 hours, and if the patient is comfortable, we may discharge the patient on the same day.
Okay.
If
so
the patient,
it's a single day procedure.
Yeah, and if the patient has any symptoms, any pain, cramping pain, which she feels uncomfortable about, then we will retain the patient for 1 day. So maximum it would be the next day the patient would get discharged.
Okay. So usually, doctor, how many such fibroids can you shrink at the same time with this procedure? I mean, of course, there are women with several fibroids in the uterus. So is it at one go?
Yeah. So this procedure, there are two. I mean, to elaborate more of the procedure, there are two uterine arteries, and it is these two uterine arteries which supply all the fibroids, whatever number they may be. So we'll be going to each of these arteries, right and left, and we'll put embolic agents inside these arteries. So it is not like we treat only one fibroid and we leave the other. Even fibroids which are so tiny, which are non-visualized during that time, will also get treated.
Okay. Okay. And how about a relapse?
Yeah, so that's an interesting question. Relapse, the patients, so to say the other way, 80% of the patients, 75 to 80% of the patients will remain without any symptoms at 2 years. That's what the studies say. 2 years, at 2 years follow-up, 75 to 80% will not need further treatment. Yes, 20% will have recurrent symptoms.
So which means the same fibroid, kind of again gets bigger in size, or is it would they have new fibroids?
Yeah, that's a good question. So fibroids, so what we do is we put in we deprive the fibroid of the blood supply. It's not as if even though we deprive, there may be a few cells which may not die. So these cells start to grow again once the treatment is over, and there may be other locations where some tiny fibroids may be sitting in which were dormant at that time, and they may also regrow in size. So yes, so these are the reasons why we may have a failure in treatment with these.
So which means hysterectomy is better?
Yeah, hysterectomy, there is always so when we say hysterectomy versus uterine fibroid, where hysterectomy is better, hysterectomy is a permanent solution.
Right.
Your uterus is gone. You don't need to worry about a fibroid in the long term. But then what are the ways in which embolization scores over is, there is no scar, one. There is the procedure is the hospital stay is very less, and the time taken for the patient to recover from the procedure. So that say if a working woman, you can't ask her to not go to work for a month,
right,
or say 3 weeks. Usually patients recover within a week with the uterine fibroid embolization, and those are the ways in which embolization would score over hysterectomy.
So finally, doctor, what are the risk factors
The risk factors
of the embolization procedure?
Yeah. So any procedure for that matter, any procedure will have its own risk factors. One major risk is the patient will have pain. The reason is you are depriving the fibroid of its blood supply, the fibroid is shrinking, the fibroid is crying, and it starts to manifest as pain. So the pain, we usually manage the pain with the appropriate pain medications.
Sorry to interrupt, doctor. Doesn't it shrink then and there? It shrinks over a period of...
that's important. Yeah, the fibroid doesn't shrink immediately. It takes some time to shrink.
Okay.
And for the symptoms to get better, the patient will need at least 2 to 3 cycles. Gradually it will get better.
Okay.
So yeah, it will shrink over a period of time. But the maximum shrinkage takes place in the first week, and the maximum pain happens in the first 2-3 days.
Okay.
So we manage that with appropriate pain medications, and once within 3 to 4 days, the patient usually the pain gets better. Other risks is when the fibroids are very huge in size. So when they shrink, small bits and pieces, this happens very rarely, small bits of fibroids can pass pervaginally.
Okay.
So this is one thing. Usually again, this is all managed without any issues. But when very large chunks of fibroid get stuck, then a special dilatation and curettage, special gynecological procedures need to be done to evacuate those bits and pieces.
So how does a woman know that it's stuck?
Yeah. So usually patient they present with pain and bleeding, and sometimes they may start developing fever, and so that's the time when we think, okay, something is amiss. Yes.
Okay. So thank you so much for talking to Covai Post, doctor.
Thank you.
Thank you.